From West Virginia Public Broadcasting.
Support for the Legislature Today has been provided by the following. The High Technology Foundation, headquartered at the I-79 Technology Park in Fairmont. Online at wvhtf.org. Connecting West Virginia families and businesses through high-speed internet services. Learn more about connecting at frontier.com.
At the legislature today, the House Judiciary Committee pored over Governor Tomblin's bill to relieve prison overcrowding. With the clock ticking down on the session, an amended bill will now be taken up by the House Finance Committee. And we'll continue our discussion tonight about children in poverty on the legislature today. And good evening, I'm Beth Voorhees. After the passage of a resolution to study the access to affordable housing across the state, the Senate Select Committee on Children in Poverty heard from two experts in a field the panel has committed to working to change: child hunger. As Ashton Mara reports, a filmmaker and an author on their first visit to the state commended the legislature for taking on the issue.
What we are starting to see is that people around the nation are seeing this as a moment in time when they can have some agency and do something.
Lori Silverbush is a filmmaker from New York who co-directed and produced A Place at the Table, a documentary focused on food insecurity in the United States. According to the film, nearly 50 million people in the country, 1 in 4 children, suffer from food insecurity, which means they don't know where their next meal is coming from. Silverbush says it is up to government to create new legislation and strengthen public assistance programs to address the problem.
When fully 47 million Americans need to rely on some sort of charity food to make it, despite the presence often of a working adult, it is no longer fair or accurate to characterize it as some sort of welfare or handout. It then becomes I think, a nutrition program that is to supplement what a hardworking family is doing, and it's an investment in kids. I don't believe we call free public education a handout. And I don't think we should call the food that we give kids so that they can take advantage of that education a handout either.
For weeks now, the committee has heard presentations on how a lack of access to not only sufficient food, but also nutritious food because of poverty is hurting the overall health of the youth of the state and preventing them from achieving academically. That is why the committee proposed and the full Senate passed the West Virginia Feed to Achieve Act. The bill would set up a public-private partnership to fund universally free food for elementary school students, with the intent to grow the program to all grade levels. It was passed by the House Education Committee yesterday, and House Majority Leader Brent Boggs says the Rules Committee is now considering suspending constitutional rules to get the bill before the full House before the end of the session Saturday.
Kids can't learn if they're hungry. You can't take a child that is in that kind of a situation, that they don't get adequate rest, they don't get adequate food. The very building blocks and many of the developmental problems, I just think that we could really have the opportunity here to set a standard for the nation to look to us as a model.
But Boggs wasn't the only one to see the legislation as progressive. Silverbush agreed and says because of the state's natural isolation, it could be the perfect place to try a program that can set an example for the country.
You are poised to be a leader in getting this thing right. And if you can get this thing right and get it studied and make sure that the impact of it is measurable, which it is measured because it is measurable, you could end up being the example that this nation is actually desperately looking for.
Janet Poppendick, a professor of sociology and the author of 3 books focused on hunger, says Feed to Achieve can only strengthen the steps West Virginia has already taken to ensure children are being fed, like increasing participation in school breakfast programs, a focal point of the bill.
You're not assuming that one size fits all, and that you're asking the districts to create a plan to address low participation where it exists, but you're not just telling them you have to do it this way. And I think that's good policy.
But Silverbush and Poppendieck both stress the universal feeding programs are only a start to helping hungry children. Silverbush says many of those children live in homes with parents who make too much money to qualify for food stamps but aren't making enough to provide the basics. She says this often happens when unemployed parents who previously relied on food stamps find a job and are immediately cut off from the help. As an example, she referred to a woman profiled in her film.
This is a well-known effect. It's called the cliff effect. This happens more than you can imagine, and I think it speaks to the need for our programs to be modernized and updated to reflect the actual realities of people's lives, not how it looks on paper. Well, now you've got a job, you're done. I think that's simplistic and magical thinking, and that getting to see how it actually works, hopefully when it comes time to modernize these programs, and it is high time, we can take the experience of people like Barbie and design a system that tapers people off and gives them the gradual, introduction into society.
Senate Majority Leader Senator John Unger, who serves as the committee chair, acquainted that cliff to the way the state correctional system works today, a system the legislature is trying to change.
I guess poverty is almost like a prison, and we also treat them the same way. Once you get a job, we think you're done, so they kind of put you out, they shut the door, there you are with your bags, and there's no reintegration back into society, and all of a sudden this cliff effect occurs and right. Almost pushes them right back into poverty. And then I can imagine that just breaks someone's soul.
Although the regular session ends on Saturday, Unger says the Select Committee will continue to meet and travel to communities across the state as they work to find ways to help the 1 in 3 West Virginian children living in poverty. For the Legislature Today, I'm Ashton Mara in the Senate.
On the floor today, the Senate passed 15 bills that had been sent to them from the House, including House Bill 3086. The bill transfers the Salem Industrial Home for Youth from Juvenile Services to the control of Division of Corrections to be used as an adult prison. The addition will add more than 300 beds to curb the state's prison overcrowding problem. And proposed legislation from Governor Tomblin that addresses that problem with prison overcrowding passed the Senate 33-0 over 2 weeks ago. But across the rotunda, the House Judiciary Committee spent nearly 2 hours working the bill today. Dave Mistich has this report.
Senate Bill 371 would institute 1 year of mandatory post-release supervision for violent offenders and would no longer revoke probation or parole for minor or technical violations. The bill would also allow the state Supreme Court to call for a standardized pretrial risk assessment for use by the Regional Jail Authority in assisting magistrates and circuit courts in making pretrial decisions. Attorney for the House Judiciary Committee, Brian Skinner, explained another major component of the bill.
For persons who are convicted of nonviolent offenses, everyone else, on or after July 1, 2013, the new subsection M requires that they be released to and subject to a period of mandatory supervision of 180 days, 6 months from their calculated discharge date.
After 40 minutes of the bill's explanation from Skinner, delegates asked questions of counsel, as well as Steve Canterbury, Administrative Director for the State Supreme Court of Appeals. Delegate John McCuskey of Kanawha County asked Canterbury about the difference between parolee supervision versus the proposed 6-month supervised early release program.
With regard to the supervision that's provided under the 6-month plan in this bill, how does it differ from current parolee supervision?
Well, it differs in the intensity, one thing. Parole supervision is not my expertise. Probation is under me, parole is under DOC, but I know a bit about it. And there is a certain level of intensity that falls off as the parolee starts to show that he's getting with the program. But it's not as intense as the intensive supervision for a solid 6 months that's relentless, that will not give up.
As mentioned by Skinner, the provision of the bill that would release nonviolent offenders 6 months early into supervised programs was amended. Early release would be placed in a judge's discretion rather than the Division of Corrections, and it would not function retroactively for those currently in the system. That change would reduce the bill's expected savings next year by about 1/3. Carl Reynolds, senior leader and policy advisor from the Council on State Governments, which studied West Virginia's prison overcrowding problem and made the recommendations on which the governor based this bill, explained how the changes to that provision would affect savings.
The 6-month release provision retrospectively so that it kicks in immediately, that's out of the bill now. That basically affects the number of people by about a third, and therefore the cost by about a third. So, for example, next year, 2015, the original projection that we made of savings was on the order of $27 million. The revised projection would be on the order of $18 million.
The committee also addressed other amendments to the bill, most notably one from Delegate Patrick Lane of Kanawha County, which would expand the drug court program and hopes to more efficiently reduce recidivism rates for drug offenders.
Ladies and gentlemen, we've heard that the goal of this is to rehab and prevent recidivism rates, keep recidivism rates low. We also heard that the current drug court program has a 9.4 or 9%. I think the data we heard earlier in the session was 9.4% recidivism rate. To my knowledge, that is the best rate, the best drug treatment, drug diversion program that I've heard any statistics on.
Delegate Justin Markham of Mingo County argued against Lane's amendment to expand drug courts around the state.
Let's be clear, the Supreme Court already has the power to do this. There's been a lot of time, a lot of effort that's went into this plan, and for us to just overstep, I would say, and try to add this into a bill that's been studied, that's had a lot of thought go into it. I just urge rejection for those reasons. I also urge rejection because what's right for Kanawha County might not be right for Mingo County or any other county in this state.
Delegate McCuskey argued that the focus shouldn't be on how much money is spent, but rather on how to address larger issues like drug addiction.
Regardless of whether we're talking about savings or not savings, what we have is a problem of addiction in the state. And I think that what this amendment does is it enables a proven winner, a proven tool to help quell that tide, and it adds an excellent piece of law to an already pretty solid bill. And I think at some point we're going to have to stop talking about saving money and start talking about saving people. So I think this particular amendment does exactly that.
Judiciary Vice Chair Tim Manchin said the money used as a result of Lane's amendment would be better spent reinvested in other programs to integrate former inmates back into society.
The experts have said that it is best spent on developing those community resources, developing ways in which our parolees can get a place to live, help them get a job, help them get treatment. We are in desperate need of additional treatment facilities and programs. By spending another $5 million immediately, we're number one, ramming this down some counties' throats where they don't want it yet.
Lane's amendment to expand the drug court program passed on a 14-11 vote. Democratic delegates Manny, Poore, and Hunt were the deciding yeas in a vote that otherwise would have gone along party lines. Other amendments to Senate Bill 371 were proposed and approved, including one that would ensure a defendant's right to remain silent during the pretrial risk assessment. Delegate Lane also amended the bill to ensure that released nonviolent and violent offenders would be monitored with GPS tracking systems. After nearly 2 hours worth of discussion and debate, the bill was approved unanimously by the House Judiciary Committee. For the Legislature Today, I'm Dave Mistich in the House of Delegates.
And this update, the House Finance Committee did consider and pass the governor's prison overcrowding bill this afternoon. The committee changed the deadline for when drug courts must be set up to 2016 instead of 2014. The bill was reported to the floor during the afternoon floor session and will be on first reading tomorrow. In a moment, we'll continue the discussion that began this morning in the Senate's Select Committee on Children in Poverty. First, here's a look at what's coming up in the Senate tomorrow. Among the bills up for passage in the Senate tomorrow, House Bill 2108, making failure to wear a seatbelt a primary offense. Senate Bill 2395, continuing criminal background checks for in-home caregivers, and House Bill 3159, allowing Mercer County schools to increase the compulsory school attendance age from 17 to 18 years of age as part of its county-wide dropout prevention initiative, and to allow Nicholas County schools to permit up to 2 unexcused absences per semester on regular instructional days to be erased from a student's attendance record if the student successfully completes the county's Saturday instruction program. We met our guest earlier in our program. Dr. Janet Poppendieck is professor of sociology at Hunter College, City University of New York. Dr. Poppendieck spoke at last night's forum on childhood hunger at the Culture Center and spoke to the Senate Select Committee on Children in Poverty this morning. Her primary concerns, both as a scholar and an activist, have been poverty, hunger, and food assistance in the United States, and she joins us tonight. Welcome. So glad you're here. What was your message to the Senate Select Committee today?
Well, my message to the Senate Select Committee was congratulations on all the achievements of school food in West Virginia, and I'll come back to those in a moment, and to welcome their consideration of the Feed for Achievement Act. They initiated this act, and I think it's a real innovation, and I'm delighted to see them starting what I hope will be a long and inclusive conversation. I think the act is a first step in a very positive direction.
Why is it so good? This is a program where private donations from corporations or grants would be given to counties so that they could pay the bills for school breakfast and lunches for everyone. So what's so good about that?
Well,
Why is that so good?
As Senator Unger clarified this morning in the meeting in the session, there is no immediate intent to pay the bill for everyone. That's a sort of aspirational goal down the road. What he's saying is that no child would be turned away for inability to pay. So he clearly expects, and the committee expects, parents who can pay to continue to pay. All over the country, we have situations that arise where parents have put money on account for a child, and it gets to the end of the month, and perhaps they haven't put enough money on account, or perhaps they're unable to replenish the account, and the child gets to the cashier with a tray full of food, and there's no money to cover the bill. Most schools will permit children to charge 1 or 2 meals, but most schools also have a limit beyond which they won't permit children to charge. And there have been terrible stories where the tray has been confiscated and then dumped within the child's view because they cannot resell the food.
Yes.
So
I've read of instances where if a child can't pay for their lunch, the school will give them something plain like a cheese sandwich and a carton of milk, and that's all they get because they haven't paid.
Right, and these are both ways of sending a message home to mom and dad that the account is low. Now, schools are pretty conscientious about this. They have typically sent an email or left a phone message. It's not that they haven't tried to notify parents, although I think there's a lot that can go wrong in that system. But there are many reasons why parents may not be able to put more money on account. And the committee's bill would create a fund to address this so that children were never turned away.
Your book, Free for All, Fixing School Food in America. What's your premise? What's the book about?
Well, my book is an argument for universal free school meals in a somewhat larger sense. You know, they say there's no such thing as a school lunch. But the way we...
A free lunch. A free lunch,
yes,
right.
Thank you. No such thing as a free lunch. But the way we pay for it is a social choice. And the social choice that we have made in the United States is to have these 3 layers of free meals for some children and reduced price meals, typically a 40-cent lunch and a 30-cent breakfast for children who are not as poor as the free lunch kids, but poor enough. And then a so-called full-price meal for everyone that's above that cutoff. The cutoff is about just a little under $36,000 a year for a family of 3. So a mom and 2 kids, if she earns $36,000 a year, she's over the cutoff for reduced price lunch. And so at that point, they pay full price. which is a misnomer because, in fact, there's a federal subsidy for that meal, 30 cents in cash and about 20 cents worth of commodities. But there are many circumstances under which a family of 3 might not be able to afford those full-price meals, and where even children who can afford the full-price meal, this system sets up an arrangement of selling food to children. And when we sell food to children, we're really kind of putting those advertisers in charge, because if the school food service looks at the children as customers, then they want to give them those kid-friendly foods. And those children are exposed to many, many hours of advertising for some of the nation's least healthy foods. So,
go ahead, I'm sorry.
No, just another way of paying for school food so that it doesn't make distinctions among families on the basis of their income, and so that we can put the adults back in charge of the school lunch menu.
It's like the director of A Place at the Table told the committee this morning. This should not be considered a handout, but a nutrition program. Think about it differently that way.
Well, it's very parallel to bus transportation. Almost nobody thinks we should bill parents based on their ability to pay for bus transportation, because they recognize how expensive, how much it would cost us to do that.
Don't give them ideas.
Right. But it is costing us to make these distinctions among children on the basis that it's a cumbersome system, it's a system that's prone to error, it's a system that leaves out children in need.
What is a la carte? You're a noted expert in school lunches. What is a la carte, and why is it a good thing that West Virginia doesn't have it?
Okay. Well, I was thrilled to learn that West Virginia does not permit a la carte sales in the cafeteria, with the exception of milk. A la carte is an arrangement where, in addition to the federally sponsored, nutritionally regulated, reimbursable meal, schools sell other items to children. They sell pizza, they sell fries, they sell tacos, they sell Rice Krispie bars, they sell slushies. There's a whole range of frequently not very nutritive foods that are sold in school cafeterias across the country. Not all states permit that full range of items. But the problem is, well, there are many problems, okay? One is that some students opt for just the a la carte items and skip the nutritional, the planned meal. Other students get the nutritious planned meal and then pick up a bag of chips or two and then get to their place and take a look at a vegetable that maybe isn't so familiar and eat the chips first and then get around to what's left of their lunch. So it undermines the nutritional integrity of the lunch. And other students want to show off their affluence, and so there are cafeterias all over the country that permit students to use cash to buy a la carte items, so that quickly that identifies the kids with no cash must be the ones eating free, tends to stigmatize not only the kids, but the meal. So that kids refer to that as county food.
I see your point. Janet Poppendieck, Professor of Sociology, Hunter College, City University of New York. Thank you very much for being on the Legislature Today with us.
Thank you for having me.
And here's a look at what's coming up in the House tomorrow. Among the bills up for passage in the House tomorrow, Senate Bill 108, creating the Unintentional Pharmaceutical Drug Overdose Fatality Review Team under the Office of the Chief Medical Examiner. This is a multidisciplinary team created to examine, review, and analyze the deaths of all persons in the state of West Virginia who die as a result of unintentional prescription or pharmaceutical drug overdoses. And Senate Bill 158 to ensure that streets are safe, efficient, and convenient for travel by all users, including pedestrians, bicyclists, motorists, and transit riders, in the policies, design guidance, planning, development, construction, and maintenance of roads. This bill was recommended for passage by the Legislative Select Committee on Infrastructure. Among the bills on second reading, Senate Bill 214 to clarify the requirements for obtaining a license to practice medicine and surgery or podiatry by making personal interviews of applicants optional at the discretion of the Board of Medicine. Senate Bill 445 to enhance state revenues by allowing the State Tax Commissioner to divert and use lottery prizes to pay the unpaid tax liabilities of lottery prize winners. Senate Bill 478 permitting employees at the Greenbrier to use the hotel's casino, and Senate Bill 504 to permit 3 or more persons producing agricultural products to form a profit or nonprofit cooperative association. This has been the Legislature Today. Tomorrow we'll talk about Medicaid expansion. Federal funding for the expansion of Medicaid in West Virginia has already been set aside by Congress, but Governor Tomblin hasn't approved it yet. Tomorrow we'll talk with Perry Bryant of West Virginians for Affordable Health Care and Renata Poor with the West Virginia Center on Budget and Policy. I'm Beth Voorhees. Thanks for joining us. Good night.
Support for the Legislature Today has been provided by the following. The High Technology Foundation, headquartered at the I-79 Technology Park in Fairmont. Online at wvhtf.org. Connecting West Virginia families and businesses through high-speed internet services. Learn more about connecting at frontier.com.